गुड न्यूज टुडे, नई उम्मीद जगाने वाला हिंदी न्यूज चैनल.
About the COVID-19 situation in Mumbai city first, which is now in fact seeing a surge in cases in the last few days or so. Well, after seeing about 200 odd cases sometime in the first week of August, that has now gone up to almost 500. The city has reported 495 new cases in the last 24 hours. With this surge, active cases have reached the 4,000 mark. Now Mumbai is among 5 worst hit districts in the state with most active cases. This comes at a time when, as per the BMC, 80% of Mumbai's population has received at least one dose of the vaccine against COVID-19. Take a look.
With upcoming festive season in the city of Mumbai, we are witnessing huge crowd gathering in market areas. We are right now present in one of the famous markets of Mumbai. This is the Crawford Market, and look at the situation over here. No social distancing, and also many of the people, in fact most of the people are seen without masks. You can see the visuals over here, and such are the situation of most of the markets in Mumbai. There's already a concern in the city of Mumbai because there is rise in coronavirus cases. There's also a high-level meeting between the CM and BMC official that how to tackle this particular situation. But on ground, as the restrictions are lifted, here in the visuals you can clearly see that how market areas are heavily crowded. With camera person Vijay Desai, this is Saurabh Akhtania in Mumbai for India Today.
All right, let's take a look at the surge in the city of Mumbai. It's seeing about 495 cases that was recorded on the 5th of September, which is yesterday. It's an increase, slight one though, from what happened on the 4th of September when the city saw 413 cases of COVID-19. On the 3rd of September, it saw about 423 cases. And then on the 2nd, it had seen 440 cases of COVID-19. September 1st, it seen about 450 cases of the infection. 31st of August, it had seen 323 cases of the infection. Joining us now is Dr. Shashank Joshi, is a member of the Maharashtra COVID Task Force. Thank you for your time here. Well, if you look at the surge over the last few days or so in the city of Mumbai, there's been a plateau in the number of cases, but it is on the increase essentially, even though it is incremental. Is this a concern given that it's been 6 months ever since the second wave started in Maharashtra, and now 6 months have lapsed? That could be a possibility of a beginning, maybe, of the third wave of infection in the state from Mumbai?
No, I think it is clearly a cause of concern because of 2 reasons. Number one is that our thick tail had become thin and our test positivity rate was down to 0.3, 0.5%. It has gone to 1.1% yesterday, when our testing was around 43,000 and you rightly reported it as 495 cases. So clearly there is a doubling of the test positivity rate. And if you look at the RT-PCR test positivity rate, it's almost up to 2%. So it's a clear sign of worry, but we have unlocked and uncurbed a lot. And people need to be very strict on following COVID appropriate behavior and protocols, which is simply not happening. Even our mask fine is only 200 rupees. If you just go to a neighboring state of Gujarat, it is 2,000 rupees. So obviously, people need to mask themselves up. We have a Delta and a Kappa strain in circulation and an occasional Delta plus. So with a Delta in circulation, if we are going to have this type of crowding, it is a recipe for disaster. And therefore, we will have to be very strict and people will have to behave responsibly. I think both the administration cannot be blamed every time, but I think the people also have to behave themselves and reduce crowding to a great extent, and even if they are in a crowded situation, at least double mask themselves to protect themselves from the virus.
Yes,
also,
but you know what?
People who are double vaccinated,
yes,
they should also be wearing masks because we will see some breakthroughs with them also. So it is very important and essential that people behave themselves. Yeah, go ahead.
Yes.
Sorry.
I want to ask you, what about the role of the administration in all of this? Yes, you've allowed double vaccinated people to get into the local train, but look at the kind of crowds that we're seeing at local trains in Mumbai, the lifeline really of this city. Where does the buck stop? Who is then supposed to control the crowds, ensure that the protocol is not followed half-heartedly like we're seeing in the case of local trains, for example?
I completely agree with you. I think we will need to tighten up administration also so that they are more vigilant and more enforcing. At the same time, we'll have to appeal to people at large also that they need to buck up because we are also seeing that our hospitals are started to fill up gradually, and it's not a good trend at all. So this is a worrisome trend. Though there may be a sufficient large exposure, a lot of antibodies in the market, which are postulated through sero surveys. 2/3 of the population has antibodies, but it should not give us a false sense of security. And we probably are not yet out of the second wave. And clearly, we may be on a threshold of the third wave, which we need to delay and defer. So I clearly see a red flag here. So there is no two ways about it. I see this as a red flag. We need to be absolutely on a red alert. And we need to do on a war footing. The BMC and people at large both need to cooperate with each other to behave themselves. With Ganesh festival, which is the largest festival of the city, coming up on Friday, people really need to behave themselves. Otherwise, we will be headed for a disaster. Last year also, we saw the largest numbers coming up before the second wave.
Yes.
Predominantly after Ganpati, not only in Mumbai, but I'm worried for Maharashtra in general. We have seen Thana creeping up to number 2 position in the state. So that's another district of concern. Of course, Sangli, Satara, Kolhapur, Nagar, Pune, many of these districts still continue to be districts of concern. So all these districts of concern are definitely, we need to be cautious and careful. After Kerala, still Maharashtra is reporting around 4,000 cases per day. It's not a good and healthy trend at all. We need to reverse this trend. We need to come down to 1,000 cases or maybe less. We need to increase our testing also.
Okay.
The good thing is in the last 4-5 days, Mumbai is up there testing to around 40-45,000. Whenever they drop down, we see the number of cases coming down. We need to keep our testing at a high peak, but I think we have to have zero tolerance for crowds.
Yes, but a lot is being said about the good percentage when it comes to at least the first dose of the vaccine, or 80% of the people are vaccinated. The thing here is that there is an understanding or sense that if you take the vaccine, then you're safe, you're invincible. What does the government then need to do to dispel that, that misconception that if you're vaccinated, you're safe forever?
I think I'm using this opportunity to talk to you, to tell everybody whether you have a single dose, a double dose, or even a booster dose, you are not safe. See, all the COVID vaccines will prevent you from death and severe disease. And that's not also absolutely true. We must vaccinate ourselves to save our lives, but you can still get COVID. So we still need to mask or double mask, particularly when you go to a vulnerable environment. And whenever you're unmasking, and particularly the unmasking situations like when you're eating food outside, you need to be extremely careful and cautious. So remember, vaccination gives you a false sense of security. Please don't be at least a single vaccine is very, very deleterious. So we need to be absolutely cautious. You are absolutely right that we need to keep on doing a lot of mass educational campaigns, sensitizing community at large, that even after double vaccination, at least for the next 6 months to 1 year, we will need to continue masking. Because remember that mask is the only safe vaccine against all variants of concern or interest.
Dr. Shashank Joshi, and I just want to talk about BJP right now, because this is the sentiment even among many people in the state of Maharashtra, that when bars have opened, schools have opened, restaurants have opened, malls have opened, why is that festivals are not being allowed? It's not just the opposition there, but even the people asking this question.
So that is for administration to decide. But I think they were going step by step. And I think at each step, they were uncurbing more and more, relief was being given. But right now, if we see a reversal of trend, it may not happen. And in festivities, crowding and congregations happen, whether they are religious or social or political. I think all these congregations for some time should be put on hold till we have finished at least 70% or 80% of the population with 2 vaccines. Single vaccine is not sufficient.
Okay. Dr. Shashank Joshi, thank you so much for joining us with your perspective. Thank you.